My name is Robin Ferguson. I went to Berry College for my undergraduate. Then I went to the University of Georgia and initially practiced in Nashville. I came up here in 1995. And I love this area. I'm a person that if I'm outside, I'm happy, and if I'm inside, I'm not. I don't have any children except for the four-legged version, and I have quite a few of those. And I totally understand that pet-human bond because I feel it every day of my life, so. In the last maybe 10 years, I've started recommending more and more veterinary pet insurance companies to owners to look into. There's so many, it's really changed in the veterinary medicine since I first started my career. And now we do so many more involved things as pets get older. Owners are willing to do whatever it takes to make sure that their pets stay healthy for as long as they can. And one of the things that can help that the most is to consider, when your dog is young, picking up some pet insurance. There's so many great insurance companies out there now. There's BPI, there's Trupanion, and I definitely would do some research to figure out which is best for your pet. And some veterinarians will give you some advice on that. But veterinary insurance nowadays, it's fairly inexpensive. It's a monthly rate, and it'll cover everything. If your dog, for instance, my dog had TPLO surgery, which is a surgery of the knee, major knee surgery, thousands of dollars. The insurance would have covered that. We do lots of chemo. Your typical chemo protocol could be $2,000 to $3,000. It would cover that. If your dog accidentally got outside and got hit and had fractures, and I've seen some of those bills at UT run thousands and thousands of dollars, your dog would be covered. You would never have to debate, can I treat my animal? Because finances wouldn't be a component of it. And as a veterinarian, it helps us so much if we go, okay, I want to look at your pet and I want to do blood work and I want to do x-rays. And the owner goes, yes, just do it. Do whatever's best for my pet, because we've taken out the financial consideration of it. And it's just wonderful. As a veterinarian, I never want to talk money if I can with an owner. I always want to be able to just treat your pet to the best of my ability. And veterinary insurance is a great way to do that. We never even have to have a discussion. Everything your pet needs is going to be done. And we don't have to try to skimp on our medicine or our diagnostics to try to guess what's wrong with your pet, because now we don't have to consider what can you do, because you're covered by veterinary insurance. So I'm becoming a big believer in that, and I'm starting to really push that, especially in puppies and kittens. It's very inexpensive, because down the road when your pet is now 9, 10, 11 and we have to do more, that's all covered. A typical heart case Doberman that we see a lot of, your medications could run you $200 a month. It would be covered under the insurance. Lots of the small breed heart disease dogs. I mean, all of those expensive drugs, the arthritic medications, they're great, but they can be a little bit pricey, and it's all covered. All this would be covered under insurance. So, and I like puppies and kittens being started because they don't already have any pre-diagnosed diseases, which then would not be covered. Your puppies and kittens are brand new. They're perfectly healthy. So everything that could possibly happen to them in their lifetime is now being covered by an insurance agency. And I think that you need to just do a little research of which one works for you. But there's some really good ones out there, and I think new pet owners should start to consider that, or people with young pets especially, consider getting that.